Our bodies are pretty incredible at healing themselves. Cuts, scrapes, most of the time, they just get better. But what happens when that process just stops? Today, we're going to dive into a remarkable piece of tech that gives the body a major helping hand by, believe it or not, turning a wound into a healing vacuum.
And this is a really serious problem. For millions of people, maybe someone with diabetes or who's been through a major trauma, a wound that won't heal can become this chronic, life-altering issue. So the big question is, how do you jumpstart a healing process that's just completely stalled out?
Look at an injury like this one. It's what's called a dehisced surgical wound, which is a way of saying a surgical incision is actually reopened. When that happens, the body's natural repair system can get completely overwhelmed. It's for these kinds of really stubborn wounds, the ones that just won't close, that you need a whole different game plan. So to really get the solution, we first have to get a handle on the problem itself. Normally, healing works in phases, right? You stop the bleeding, then you have some inflammation to clean things up, and then you start rebuilding. But sometimes, that assembly line just grinds to a halt. And here's what's going on. The wound gets trapped in this vicious cycle. That inflammation phase, which is supposed to be short and sweet, just never ends. It becomes chronic. It's like the body's alarm system is stuck blaring. And with all that noise and chaos, the construction crew, the rebuilding cells, can't even get in to do their job. Healing is stopped dead in its tracks.
So, how do you break that cycle? Well, this is where something called negative pressure wound therapy, or NPWT, comes into the picture. And it is a truly ingenious way to create the perfect environment to get healing back on track. To put it simply, it's basically a medical-grade vacuum cleaner for wounds. The system is actively and constantly pulling on the wound under a completely sealed, controlled environment. So we're not just talking about covering the wound here. We're talking about fundamentally changing its entire biology.
So how do they actually apply it? It's pretty much a four-step process. First, a special porous foam is cut to fit perfectly inside the wound. Second, the whole area gets covered with a clear film to make it totally airtight. Then, a tube is connected through that film, and finally, a pump gets turned on to apply that controlled suction.
And here you can see it in action. On the left, that foam is being fitted right into the wound bed. And then on the right, you see the whole thing sealed up and connected. You can almost see how the vacuum gently pulls on the foam, starting its work right away.
Okay, but how exactly does suction heal a wound? It sounds a little strange, right? Well, it's not just one thing. It actually sets off a whole cascade of powerful effects, both on the big picture level and way down at the microscopic level.
First off, it acts like a cleanup crew. The vacuum is constantly pulling out all the bad stuff, excess fluid, infectious material, little bits of debris. Just think of it like clearing away all the rubble from a construction site, so the builders, your healing cells, can finally get to work.
Second, it's a master of logistics. That negative pressure helps bring down the swelling, and when the swelling is reduced, blood can flow in much more easily. That is absolutely crucial, because it means more oxygen, more nutrients, and more antibiotics get delivered right to the front lines where they're needed. Third, it's a physical force. The suction literally provides what doctors call macro deformation, which is just a fancy way of saying it physically pulls the edges of the wound closer together, shrinking the gap that the body has to fill. And fourth, it actually encourages new growth. That gentle, consistent pulling on the wound bed stimulates the formation of something called granulation tissue. That's that healthy, red, bumpy-looking tissue that forms the foundation for new skin to eventually grow over.
Now this is where it gets really fascinating. At the cellular level, the foam creates what's called microdeformation. As the vacuum pulls, it literally stretches individual cells by 5 to 20%. This physical stretching acts as a powerful biological signal, basically telling the cells to wake up, start dividing, and ramp up the whole healing process.
So, with all these incredible benefits, where is this technology actually being used? Well, its applications are incredibly diverse, and it's become a real cornerstone of modern wound care. The list is pretty long. It's used for all sorts of things, from really severe traumatic injuries like open fractures to chronic wounds like diabetic ulcers and pressure sores. It's also vital for managing those surgical wounds that have opened back up, for treating burns, and even for holding fragile skin grafts securely in place. And this is definitely not a one-size-fits-all kind of treatment. While a pressure of negative 125 millimeters of mercury is a pretty common setting, the therapy is highly customizable.
Doctors can dial the pressure up or down anywhere from a very gentle -40 to a much stronger -200, tailoring the treatment perfectly for each patient's specific wound.
Of course, behind every wound, there's a person. So we have to ask, what's it actually like to live with one of these devices attached to you?
Well, let's compare it to traditional dressings. With this therapy, dressing changes are way less frequent. We're talking every 2 or 3 days instead of sometimes daily. The sealed system is also much better at containing any odors. The biggest trade-off, though, is mobility. Being connected to a pump, even a small one, can be pretty cumbersome.
But the technology is always getting better. The bulky machines from years ago are being replaced with much smaller, portable, battery-powered devices. Some new ones are even canisterless. These advancements are making the therapy so much more manageable, and they're letting more and more patients recover in the comfort of their own home.
But even with these portable devices, the psychological side of it can be really tough. This quote from a patient says it all. "It made me feel very, very uncomfortable, embarrassed. I didn't want other people to see it." It's a powerful reminder that being attached to a machine can make people feel self-conscious and isolated, and that great care always has to consider the whole person. So clearly, negative pressure wound therapy has totally revolutionized how we treat complex wounds. But what's next? Well, the future is moving toward smart dressings. Imagine a dressing with tiny sensors that can actually monitor for infection and send data to your doctor in real time. It's a system that doesn't just heal, but communicates. It's a pretty amazing glimpse of where medicine is headed.